Postpartum depression usually happens after a mother has a baby and her hormones are not in place, and it causes sadness and weepiness, and sometimes the mother doesn't want to interact with her baby right away.
Thank you. How is that different from the baby blues?
The baby blues is milder, and it's the same situation. It's all hormonal. The hormones are not in place, and the mother has difficulty associating with her baby.
How are these two related to postpartum psychosis?
Now, postpartum psychosis is awful. That's the killer. Postpartum psychosis is when there's a lack of reality caused by hormone deficiency in the brain, and the mother will become suicidal or murderous.
What causes PPD?
Postpartum depression. As I said, it's an fluctuation of hormones that really, after the mother has her baby, the hormones are not there immediately, and causes the mother to become very strange.
Who is at risk for these illnesses?
No one knows. No one knows. With postpartum psychosis, it says it is 1 in 1,000, but no one knows what person is going to get it. No one knows that.
Is there a cure?
Well, with postpartum depression, they do have medication. Postpartum psychosis, they really don't have one set medication. Usually it's trial and error.
What should a husband, family, and friends of a pregnant woman look for?
Any sign of sadness, any sign of hopelessness, any sign of not being able to eat, talking in a different manner, anything that is strange and bizarre from the new mother's usual personality.
Have you read that Marie Osmond, Brooke Shields, and Hayden Pantera all had some form of this mental illness?
Yes, they had postpartum depression, and they did not have postpartum psychosis. Yes.
Do you recall any specific details about their experiences?
One in particular is that all of them kind of ran away. And that's what Melanie did. She ran away too. She ran away after her baby was born.
How long after the birth does this mental illness persist?
No one knows.
Is there anything that can be done to prevent it?
No.
Tell us what success you've had with the Melanie Blocker-Stokes bill.
Well, that is the biggest disappointment to me. The only thing that I can see that has happened is that every mother is supposed to be tested for postpartum depression after her baby is born. But most mothers want to go home right away, so they don't tell the truth if they do feel something. Also, it might not happen right away. If you test a mother in the hospital, it might not happen and maybe until 3 or 4 days later, after they go home.